What's going on, everybody? This is Christian Brindle, and today we're going to be talking about some late enrollment penalties, why you might possibly get tagged with them even if you didn't deserve it, and what you can do to kind of fight back against it. If you don't know who I am, my name is Christian Brindle. I'm a Medicare health plan expert and specialist. I'm a licensed insurance broker, and I own a company called Christian Brindle Insurance Services. I've published multiple books on insurance and Medicare specifically, and I host the ever-popular The Everything Medicare Podcast. Today we're going to be talking about late enrollment penalties. So let's first talk about what a late enrollment penalty is, also known as LEP for short. A late enrollment penalty is basically a penalty that CMS, the Centers for Medicare and Medicaid Services, assign to you if you go any amount of time without credible Medicare Part D prescription drug coverage. Now, if you're working and you have coverage through your employer, this, in a lot of cases, if it's credible coverage, will basically count as having credible coverage, even if you decide to postpone your Medicare and take it later. But let's say you sign up for Medicare and you don't think you need a drug plan because you don't take any prescriptions, and you go a year without the prescription coverage, and then you decide, hey, I might need this, and you sign up for a Medicare Part D prescription drug plan or a Medicare Advantage plan with drug coverage included, they're going to tack on what's known as this late enrollment penalty onto your monthly premium monthly, and it's going to be there for the rest of your life as long as you have drug coverage. So it's really not a good idea to go without any drug coverage for any extended amount of time when you're on Medicare, even if you don't take any medications. Now, do I agree with this? Absolutely not. But the government is the government. They do all kinds of shady things, in my opinion. I think it's a shady thing. But now, there are situations that you might be tagged with a late enrollment penalty even if you didn't go ever without a gap of coverage. We see it happen all the time. It happens to our clients, and we are able to kind of help them untangle that mess and get it fixed. Sometimes the Centers for Medicare and Medicaid Services have incomplete, is the word I want to use, documentation on your work status and your credible coverage status. Sometimes they just don't have correct filing. They don't have everything they need. And sometimes they will tack on a penalty even if you had no gaps of coverage. And people always just panic and they don't know what to do and it's the end of the world. Not to worry, it's easy to fix. What typically happens is whichever insurance company that you signed up with is the one that CMS trusts and basically puts in charge of tacking this penalty on top of your plan. Even though it's them that's saying that you need to pay the penalty in the first place, all you have to do is you will be sent a form from your health plan in the mail that asks for information if in the event of the late enrollment penalty being wrong. You fill out this form, and basically they will want information on the credible coverage and the dates you had it and so on and so forth, what kind of coverage it was. And if you did indeed have the coverage that they're looking for, they're going to be able to go back, do the research, see that in fact you did have this coverage and remove the penalty. Sometimes you can even call the health plan and do it over the phone. 99 times out of 100, that's the solution, and that fixes it. If you got charged a late enrollment penalty, even if you shouldn't have, this is the best way to go about it. If you tried this and it hasn't worked, you have to call Medicare, unfortunately, and kind of go from there. It can be fixed. It can be challenged. But I'd say 99 times out of 100, this is the best way to fix these late enrollment penalty mistakes, and they happen from time to time. Thanks so much for taking some time with me, everybody. If you found this video helpful, drop a like on this video, drop a comment down in the comment section on what you'd like to see me talk about on future Medicare and insurance-based videos, and subscribe for future content. If you need help with your Medicare health plan, we partner with all of the largest insurance companies available in the insurance industry. We're licensed in 7 states. You can find a list of those states down in the description below. Also, our contact information will be found in the description below. So give us a call. I'd love to talk with you and see if we can possibly improve your situation. Thanks so much. Have a great day.